Good morning, and thanks for joining us here today. I'm Carolina Albernas, CEO of the Brazil-Canada Chamber of Commerce, and we're here today with another Brazil-Canada Talks, prioritizing mental health in our professional lives and for our team members, organized in partnership with our member PsyMood Technologies to touch a point that is even more critical at the moment we are living, mental health illness and its impact in the workplace, and how technology can support companies to address this issue. PsyMood is an online platform that offers mental health support based on your language and cultural background using matchmaking, scheduling, and video therapy tools. It's not easy to talk about mental health issues in your first language, imagine in the second language. So we invited Carolyn Van, management consultant at Crayne, to host a conversation with Rod Bergel, co-founder at PsyMood, and Nadia Prando, a licensed therapist. Just a few housekeeping rules. After the presentation, we'll have a Q&A session with the panelists. So if you have any questions during the webinar, please type them on the Q&A box and you'll answer them in the end. First, for those who are not familiar with the BCCC, for 47 years, we've been building relationships between Brazil and Canada, strengthening the bilateral relationship in investment, trade, best practices, and mutual growth and prosperity. Our relationships are private and public, featuring the managing directors and decision makers of large and very large corporations, as well as small business and startups and institutions and associations. Our volunteer board of directors has expertise, knowledge, and connections that can only be found by being active players in the Brazil-Canada market. We're a membership-based association that supports its members through information networking. And if you want to learn more about how we can help you in your company, please don't hesitate to contact me. So without further ado, I would like to call Carolyn, Rodrigo, and Nadia to join us and start this discussion on a very important subject. Welcome, and thank you so much for being here. Carolyn, I'll pass the mic to you. It's your floor now.
Awesome. Thanks so much. Thanks so much for the introduction. And good morning, everyone. Or I guess depending on when you're watching this recording or if you're joining us live. So as Carolina mentioned, I'm a management consultant. And what that work entails is that I get to work with companies on their growth and innovation challenges and strategies. And sometimes along the way, I get to meet some really interesting small businesses and startups. One of them recently last year, I believe, in the year that was 2020, I got to meet an organization called PsyMood. So I'm going to pass the mic to Rodrigo and to share a little bit about PsyMood, just briefly, so that you can introduce yourself to the crew.
Good morning, everyone. My name is Rodrigo, and I'm one of the founders of PsyMood and the CMO as well. So last week, me and my co-founder Fred, we were trying to have an idea to create a startup. So we wanted to help people somehow, and we had many ideas, and in the end, we felt that there's a gap of serving mental health for a specific audience that is the immigrants and the minorities who live here in Canada have difficulty to find a proper service for them. So we had an assumption that if it's not easy to talk about mental health in your first language, imagine your second language, and then we decided to create a startup to help them based on language and cultural background.
Awesome. Thanks so much for that. And of course, what would PsyMood be, and how are we going to get ourselves out of this mental health crisis without specialists and practitioners? So I'd love to pass it over to Nadia, and you can give yourself a little bit of an introduction as well.
Yes, thank you, Carolyn. Hi, everybody. My name is Nadia. I'm a therapist. I have more than 10 years of experience treating adults and families. And now with COVID, we can see the demands for mental health have increased abruptly because unfortunately our mental health is not in a good place with all the isolation and everything that we're going through. So I'm very glad to be here and talk a little bit with you guys.
Thanks for joining us. So obviously this is a massive topic. I think that if we needed to, and if we could do one of these conversations, one of these series like every day for the rest of life. But we're going to try to keep it within 45 minutes ish, obviously, and with some room for any questions that people might have. We're going to talk about some things that might be applicable and helpful for us as individuals. As individual professionals and just as individual beings, and then really take a look at what mental wellness could look like within an organization. So, obviously mental health is nothing new, right? Ever since we've existed as a species and human beings and have had our mental capacities, the health of that has been important. But, why? I guess so I'm curious to know like what everyone's thinking about when it comes to why is mental health still something that is so difficult for us to wrap our heads around?
Yeah, I think we come from a time where we value more the physical body than the mind, right? And we believe that the physical body was the one sending us commands, that it actually was the physical body would rule everything.
Mm.
And now with research, we're learning that even though the physical body is important, but actually the mind and our mental health actually interferes with the physical health. So we're learning that we should value more mental health, because if we're having a good mental health, it means that also our physical health is going on the same path. So I think it's more about research, and we're still learning a lot about the brain. There's still a lot of things that we don't know yet. So I think just the improvement with technology, better research, we're being able to now understand that actually the mind is pretty important.
Yeah, based on my experience with mental health conversations and doing therapy, yeah, I can see that and feel that it really helps, not only in the mood, but in all aspects of the health. Being a son of a psychiatrist, my father always have told me about the case of how the case of his patients, how he can help them. And since I'm a teenager, I love doing therapy. I'm a big fan. And when I came to here to Canada, I tried to continue that, and I found a therapist that speaks language and is from the same place that I came from. So the connection is becomes stronger, and she really helps me a lot.
Let's get more people loving therapy. That's great. That's a great attitude to have. And that's so great that you've had that experience in your early teens, right? So from both of you, both of you have had exposure into the space in different ways. Rod with some family background and having early exposure to professional support. Nadia being in the industry, I think you said how many years?
10 years.
10 years, so a decade, right? Which must be crazy to think about in a way as well. So with both of your experiences, how are you knowing that there's, knowing how far we've come, and knowing that we're still all, I think, trying to wrap our heads around this mental health thing? How are you feeling? Are you feeling like hopeful? Are you feeling concerned? Like, what's your feeling about where we need to get to?
I'm very hopeful. I'm seeing that we are developing, we're learning more, we're going in the right path.
Okay.
Of course, I would love that it would be a little bit faster, but we're going there, because there's still a lot of prejudice, right, that attached to gender. For example, men should not feel anything. Men should be strong. They shouldn't cry. They shouldn't show emotions. So we're still stuck on certain beliefs that doesn't make sense anymore. So we still have a lot of things to be, a lot of beliefs to be changed and broken. Because if we're still listening to our parents, grandparents, they still have the same belief, right? Don't talk about emotions. You don't need that. This is for the weak people. And it's actually the opposite. If I'm taking care of my mental health, this means I'm stronger than ever. This means that I'm giving myself all the strategies and all the skills that I need to have a better well-being. So we're going.
That's good.
Yeah, I agree. And there is this stigma, right? For many cultures and in other countries, it's not normal to go to search to seek for mental health support and to do therapy. And here in Canada, thankfully, it's very common to talk about it, and in work as well. They offer the not only the sick days but the mental health days as well. So it's normal for people. It's good to know that there are many ways of seeking for support and many resources here in Canada. So it's good to break this stigma.
Right. Yeah. I'm glad to hear that both of you are feeling positive about things. Right. I think that so, there are a lot of differences and stigmas that exist in different cultures. And I guess the word differences, right? But there are also things that are very common and similar across all of us, right? Sometimes these big things that happen in the events that happen globally can sometimes, even if they might be tragic, can sometimes have its way of bringing us together, right? So let's talk about the year that was 2020 and continuing onwards, right? This COVID thing that's happening has, in an interesting way, brought us all together on a global scale, right? Obviously, with unfortunate circumstances, but the topic, the trending topic, right? Digitally is hashtag COVID, right? Everyone's talking about COVID. So rightfully so. So, what do you think the impact of COVID has been on our mental health? And yeah, just to kind of open the floor for general thoughts on that. And what do you think might be some things that we really need to be focusing on?
Yeah, I think with COVID, we've noticed it opened the door for us to give even more value to mental health, right? Because we were put in a situation where we don't have the freedom that we used to have anymore. We feel frustrated, we feel angry, we are afraid of the virus. So a lot of intense emotions that of course are going to affect our mental health. And being inside the house, not being able to go outside a lot, it has also the positive effect, because if you are inside of the house, don't have many places to go, many people to see, you're kind of forced to reflect a little bit more, reflect about you, reflect about your life, reflect about what's going inside of your house, the relationships. I think one thing is positive that gave us this space to reflect and get to know us a little bit better. But on the other side is also kind of testing our limits. And everybody that already suffered from mental health before COVID got worse. And people that didn't have any symptoms before are also starting to notice, well, something is off. I don't feel good. I'm more irritated. I'm more frustrated. I'm having explosions. I don't want to be here anymore. I had enough. So it is interfering a lot, but it's also giving us a space to reflect more about mental health, and is also forcing us to take strategies to do something about it, right? We can't pretend that mental health is not important anymore, because the big part of the population already is showing signals of mental health issues. So if we don't do anything right now, maybe in 6 months, we're not going to have healthy people to be able to work. So what are we going to do? First, we need to prioritize mental health to make people healthy and good so that they can go to work, so that they can be productive. So this is going to be the target right now.
Yeah, just to give some numbers regarding that, that justify that around 20%, one in in 5 Canadians have experienced mental health problem or illness, uh, and this means like 500,000 employees who are unable to work every year, right? So talking about the pandemic stage that we are living on, uh, around 40% of Canadians think their mental health has deteriorated since the start of the current pandemic.
Wow.
And these numbers are according to the Canadian Mental Health Association. So the good things that people and companies are paying attention to that. And this is the time to think about mental health and to offer ways of supporting the employees.
Yeah, you know, there's you brought up a lot there, Nadia, as well. There's a ton happening, right? It not everyone kind of sees the positive in some of this, right? So it was really nice and refreshing to hear your perspective on you know, having more time to think about mental health. I hope that everyone has their support systems in place, right? Not everyone might have that, which is where folks like yourself comes in, right? Which is where organizations like PsyMood comes in, offering like virtual access, right, to specialists. You know, it's and thanks for sharing some of those numbers, Rod. You know, it's estimated that for Canada, there's a 51 billion per year loss, right? So economically for our country, it's not looking great. And you know, and we have to understand that those with mental illnesses are less likely to be employed as well. Right. So it directly affects our employment rates as well, significantly. So they're less likely, and the less likely is not in the single digits. It's that like 70-90%, right? So it's quite significant. Now, going back to having support systems in place, for some of us who are working full time, we spend most of our waking hours working, right? we sleep 8 hours a week on a good night, right? If we can manage that, manage getting that done, and then for most of the time that we're awake, we're spending time with our employers, right? You know, tackling our respective missions and running our own companies. So just kind of like open floor thoughts on, you know, the responsibility that companies have, and thoughts on what companies might be able to do to help support mental health.
Yeah, definitely. And I liked where you were going. Like, we have to think about that we spend most of our time at work. So why not open a space at work for us to be able to also target our mental health, right? And there's a lot that can be done. I think one of the most important, or where we should even begin, is if companies were able to offer workshops, because a lot of the population still don't have education and proper information about what is mental health, what is the importance of it, what are the symptoms or signals that maybe I'm suffering from anxiety, maybe I'm suffering from depression. So just offering workshops about mental health, symptoms that they can be alert. This is already a great prevention, because by informing the people, you're allowing them to check with them. Am I okay? Or am I showing some of those symptoms? Should I look for help? Shouldn't I? Because the problem is that if we leave a person, she's showing symptoms for 2 months, 6 months, 1 year, and she hasn't been looking for treatment, then it is going to become a chronic issue. It's going to become a chronic depression, chronic anxiety. And that is far worse to be treated, because that means that you're going to have to be medicated and have therapy frequently. So it's a lot of more money that we're spending if we're not preventing. And also for the person's body and mental health is worse if she waited that long to start looking for treatment, right?
Mm-hmm.
Also, I know that the Canadian government already has a website that they show. They have toolkits. It's on mentalhealthcommission.ca. They offer toolkits for companies that want to improve the mental health. So companies also have the support to start doing that. Why not? Offering better insurance for the employees, because insurance that cover $500 a year for therapy, that is nothing. That is about 2 to 3 sessions, and we can't do much with 2 to 3 sessions. So offering your insurance that gives them $1,500 or $2,000, it's already much better to give them the possibility for do a better treatment, right? Offer to HR would be interested in offering individualized programs or meetings so that they could know people better and really track what is your goal in this company, how can we help you, are you feeling okay in the position that you are, how are the relationships with the co-workers working for you. Give it just a space for the employee to be able to share what is going on with them, if they're satisfied, if they're not, what would be the plan to help them be in a better place. Just offering that space for employees to be heard. That is so important. When we feel heard, when we feel that there's somebody else wanting to know how we are, what are our goals, then we feel protect. We feel that we have value. We feel that we are important. And when we feel that we are valued, that means we're gonna have more energy and we're gonna want to work and do our best because we're being valued by the company. And also offer training for managers, right? Managers are there to help the employees. So if you're able to offer your managers some workshops and courses that they can take to identify some of the symptoms of mental illness, that is gonna make their life easier to notice if one of the employees is not doing great. So maybe this is the time to show this employee, hey, I noticed you're not doing the same, things are changing, and here are some options or treatment, you can seek help here, and open that space for conversation, all right? Or also offer some quiet space that people can go and relax a little bit during the day, right? We gotta stop treating ourselves as robots. We're not robots that they're just there to have our huge productivity. We're human beings, so we need to be treated this way. So human beings need to have breaks now and then. We work better if we have more breaks during the day, because that helps alleviate the pressure, the stress. Then when we come back, we're more productive. Or having that place to be able to relax in a quiet. You stay there 10 minutes, relax a little bit, maybe listen to music, and then go back to work, right? Yes,
Just to complement what Nadia is saying, yeah, that's why we exist. PsyMood want to help companies, individuals in this seek for improving the mental health, improving also the productivity of each employee, right? And each individual and the level of happiness that they have, not only at work, but also in life. So understanding that each individual has different challenges and needs and values is very important for companies to have this culture of to be inclusive, to understand that the needs are different. So that's why we offer customized solutions for companies, and we are open to talk to any company that want to offer ways of improving the level of the mental health support in their companies.
Awesome. Thank you both. Both of you mentioned some really key things as it relates to implementing any type of change management or innovation within an organization. So through the work that I do, there's about 10 to 12 things that need to be put in place in order to integrate something new into a strategic plan within an organization. And both of you actually touched upon some of them. I'm not going to name them all off now, but I'll touch upon the ones that you two brought up. Definitely speaking to what Rod brought up, really understanding the diversity of the needs that exist within your team members is so critical. So it's important for us to not treat all of our staff as a monolith, right? Making assumptions of what everyone needs. Remember that, you know, every cultural background, every wave of immigration, right, has their own type of experiences that come with that. So to what Nadia brought up as well, that speaks to not treating ourselves and our team members as robots, right? So the acknowledgement that there's a diversity of needs that exists within our people is so critical. Coaching. So because employees spend most of their waking hours at work, right? This means that employers have a huge responsibility and opportunity, right? We're seeing that people, when they're looking for work and applying to jobs, they are asking the question of, what does your wellness program look like, right? So that's becoming a competitive advantage in employer branding, right? Can you attract and retain your top talent, right? So when it comes to productivity and giving your organization a competitive edge, that is, your wellness program is most definitely a part of it. And I think that with more global awareness of how important mental well-being is and health is, we should be expecting that, you know, candidates that come in, people that apply to jobs at our organizations, they're going to ask questions about it, right? They're going to want to understand, you know, if it's going to feel healthy working at your organization, right? If managers know the indicators to look out for. So if you're a manager out there or someone that's directing a team, some of those signs, so those indicators might be, you know, are your team members, do they seem always tired, right? What does your absenteeism look like? Are people absent more than 5 days a year, right? Are you finding that your staff members are kind of disengaged and bored, right? These are all like signals that you will want to pay attention to, right? That good managers will pay attention to. You know, there is absenteeism, right? And then the polar opposite to that is presenteeism. Presenteeism is when your staff members are really engaged in their work. Are they present in their work, right? Are they there? We obviously all have things that are happening in our lives, right? We're thinking about like kids that we need to pick up in like 10 minutes, right? We're thinking about, you know, our parents who are not doing so well, like health-wise. So there's lots happening in our minds. And if we're not helping to bridge that gap and providing support in our staff's mental wellness, then, you know, your productivity is going to be shaken, right? Within your workplace. So, you know, employee coaching, you know, leadership, having the awareness of the connection between mental well-being and productivity is something that we need to get to. Benchmarking as well. So there are HRAs, so they're health risk assessments that are done. Typically, they are conducted at the start of implementing a wellness program, and then perhaps like a year after, to see what the impact is, right? Anything that you implement within an organization, I always highly recommend to identify how you're measuring the success of it, right? The equivalent for a wellness program is that HRA. So measuring a benchmark of where you're at today, right? Essentially, it tells leadership in your company, like, how are we doing, right? Like, what do our disability claims look like, right? Like, what are people, the absenteeism rate, engagement, and then for a year later, you'll measure it again to see if anything that you've implemented, like workshops, like perhaps integrating a solution like PsyMood, has that shifted anything, right? And what else did I want to bring up? Yeah, constant communication. I think that, you know, especially through my work, implementing anything, I know that only so much, there's only so much it can become, there's only so much will be effective if, depending on how staff members are doing mental health wise, right? So many scenarios, I will work with a team, and I know I can tell by some of those indicators already that there's only so far this new program or the strategy can go, because I know that there might be blockers there when it comes to mental health. So I think that, you know, lunch and learns are great, right? Workshops are good, especially because, you know, not everyone might have the time after work to investigate in those things, right? They might have kids to take care of, all these different things. So if you can introduce the importance of mental health in the workplace, I think that's great. I think that what would be great to see is for us to move past the once a quarter workshops and to invest in always on programs, right? Mental well-being doesn't turn off within ourselves, right?
Exactly.
So yeah, I think that would be great.
Yeah, exactly. It's a constant worry, right? You shouldn't just give a little bit and, oh, I've done my job. If it needs to be a constant program. That's why it's good if companies can have a well-being program or use a platform like PsyMood to really help them create a program that is going to be a long-term program, right? It doesn't make sense for you to offer your employees 1 month of well-being and then the rest of the year there's nothing else, right? We need to be aware and we need to be taking care of the mental health constantly, because we don't want the employees to get to this state where they have to take 2 years
right
away to be able to take care of their mental health, right?
Right.
That is too long, and that is a lot of money that is just being thrown away, because if we treat from the beginning, if we have those tools of prevention is always a signal of low cost.
right
Prevents is, it's a low cost and much better results than having, I'll treat later when they are already on their worst, right? It's gonna be a long treatment and it's gonna cost much more.
Yeah, that is true. And it's very important to create these structures with workshops, training, and monitoring programs, so people can feel included and understand how they can improve. And especially for immigrants, it's very, because they in most time they don't have the strong network that they had previously in the home country, and they don't have the social support that they had. So it's very important to have these resources, and especially for PsyMood, we offer these solutions based on the language that they can talk to someone who will understand their the background, the references. So just to give an example, for a Brazilian, when or a Latino, any Latino, just for example, when they say they are missing a hug, the physical contact, to touch people and to kiss and to have more close relationships, and someone that has the same background and will understand this better than someone who will understand but not really feel what they are feeling. And the same thing is for minorities, someone who has been passed by the same kind of experiences. We understand more the challenges that the other person is passing through. So we believe like we could help in that, and offering solutions for companies. They can help their employees, and in the end it will be good for the company and the lives of the employees, because they will be more productive, and they will be happier, and a happier employee will become a better worker.
Let's dig even deeper into that. So, you know, almost 45% of Canada's population don't have English as their first language, right? And I believe that everything is by design, right? So if you leave out certain populations out of the way that we build our structures, the way that we design things, it's not going to serve those populations, right? So, you know, let's talk about, you know, I guess for Nadia, right? Was there a point in your career where you thought to yourself, maybe I should offer services in Portuguese, or were you always offering services in Portuguese? Like, I'd love to hear more about that with you.
Yeah, sure. No, yeah. So people that doesn't know, I'm from Brazil. I've been here in Canada for the last 5 years, almost 6. And in the beginning, no, I was in a clinic treating everybody, Canadians, like not Canadians, mostly immigrants, right? And then Brazilian people found me. And it was, for me, it was a surprise because it was my first experience. And I was like, whoa, now I'm having a lot of Brazilian clients, and it makes total sense, because they were telling me, I've been waiting for such a long time to find someone that speaks my language. I know that I need therapy for a long time, but I didn't feel comfortable talking to someone in another language. I don't think that I'm fluent. I don't think that I would be able to express myself in any other language. So I was really needing that. And that was a shock for me. I said, whoa. And I started looking for other professionals that would speak the same language as me, because there was a lot of clients. And I had it took me a long time to find other people that would speak the same language, that I could refer some clients to them. So I loved when PsyMood got in to help me that, because then now it's easier for me to find other professionals that speak the same language so that I can refer. But also it's a great platform to help those clients that are really in need to find a therapist that they will feel comfortable talking with. So PsyMood is helping a lot of people, and this is so important. People that are suffering for a long time because they don't think they can have the help.
Wow, that must have felt you almost must have felt a sense of like relief when people came to you and was like, oh my gosh, like finally, right?
Yeah, definitely.
Yeah.
For me, it's much easier, right? When I'm speaking it on my native language, the session becomes easier. I know what they're talking. I know where they're coming from. Definitely.
Yeah, and this is we are starting here in Toronto, but this business that has the potential to be a global business, because we have immigrants everywhere, and this is a true challenge for immigrants in any country, anywhere in the world. So, but this is the right place to be launching this, because Toronto itself, more than 50% of people that live here speak other language rather than English at home. So in Canada, that 21% of the entire population is formed by immigrants, and these numbers are even more significant here. And in Ontario, 40% of all the immigrants that come to Canada come to Ontario, 40%, 45%, and especially in Toronto, this is very representative, more than 50% is a lot. So we believe we help these people that have different cultures, religions, and language, and also the companies that where these people work.
You know, I think even just by the sheer fact that PsyMood helps people navigate and find people is so important, because we know that people like Nadia exists out there, right? It took you a while to find someone else, right, to help with like your overflow and referencing, right, referrals to people. You know, especially when you might be experiencing mental unwellness, right? If there are opportunities to make the experience of seeking support easier and less stressful when you might be already feeling stressed, right? Then I think that's what we should be doing, right? So I think that's great. Thank you for sharing, both of you. You know, I think that to your point, Rod, you know, starting with Ontario or starting here is just the very start, right? To your point, like immigration is everywhere, right? And there's always different waves. I really appreciate what both of you are doing, specifically PsyMood as well, because you know, if we can provide people with the experience of entering an environment that is supposed to be designed to support people's well-being, and to not have to contribute to people feeling already exhausted, trying to explain cultural context, trying to explain what it's like to be, you know, a daughter of, you know, war refugees, right? Trying to explain to people what it's like to be, you know, the only woman of color in her workplace, right? Then I believe that's going to be part of better care, right? Better and more relevant and more effective care. Yeah, so I appreciate that. And so Rod, you know, you shared a little bit about with your background of, you know, your upbringing, growing up with your father, right? And having early exposure to mental wellness. Why is this, you know, such an important priority for PsyMood? And do you see focusing on cultural and linguistic diversity something that's going to be part of PsyMood's long-term plan?
Yes, so this is our territory, it's our differential. We know that it's possible to find support in using filters in other competitors that we have, but it's just a filter they offer. It's like they are not focused on that. So in the end, it becomes difficult, and there are no companies offering what we are focusing on, and we believe this can be a really interesting for the users. That myself, I had difficult to find a professional that speaks my language, but I found, right? So now it would be much easier to find. Fred, my co-founder, also found in another platform someone who speaks Portuguese. He's also from Brazil, and he's doing therapy with her. But it was difficult. It was not so easy. It depended a lot on referral and looking for it. And we are making this process easier, and people also can get a feeling in our platform of the different professionals. So before they schedule any session, they can see a video of the professional speaking their approach, because there are many different approaches as well of mental health support. They can see who they empathize more. So yeah, what we are doing is like making a mental health more tailor-made for each person or for each company.
I think that going back to the point that we were talking about earlier of employers having such a huge level of responsibility here, PsyMood is right now is working on a couple of pilots in what that looks like, right? How can, knowing that employers have a huge level of responsibility, are really stepping it up when it comes to really understanding the impact of mental health and productivity and their organization's growth. So PsyMood right now is running a couple pilots, looking to connect with companies who want to figure out a solution towards that, right? So if you are a manager, or if you just simply want to explore this topic within your organization, reach out. I'll connect with BCCC to make sure that there's an appropriate email in the, I guess, follow-up communications. So if you're interested, reach out. And I would say, maybe like to wrap it up, what would be, for both of you, Nadia and Rod, what would be your big kind of, I guess I'm going to ask a two-part question. So your like top 3 tips when it comes to like managing your everyday mental health, while you go about your everyday work, right? And then also like what you would hope to see, like if you had a magic wand, right? Your big like hopes and dreams for the work that both of you were doing. So whoever wants to start, go ahead.
Okay, I can go first. For people who, some tips for people to improve their well-being. I would say try to have a balance between work and life. This is like the key secret for having equilibrium and be happy and enjoy what you're doing. And first of all, look for some work that you love, because you spend most of time working in your life. So people don't I know it's like hard to find something that you really love, but it pays off because you will be happy at work, and you will enjoy working. It is not going to be a struggle that you have to work and then go home. And so you have to find something that you love and enjoy. Always prioritize wellness, friends and family, and have a hobby.
Great. And what would be kind of your hopes and dreams that you would like to see happen?
Myself?
Yeah, for PsyMood, or for
Okay.
the mental health, the mental health space.
Okay, so my dream and hope is to help as many people as we can through PsyMood, and see PsyMood help improving the well-being of all these people that need support, and making in the end making the companies that they work more profitable and more prosperous.
Thanks for that. Nadia, you're up.
I totally agree with Rodrigo's ideas of helping maintain the well-being, right? Most people that come to me, they're very frustrated with their job because they were seeking job just because of the money, and not really because they had an interest, or they love what they're doing. So when we shift to money instead of ourselves, that is definitely gonna, at some time, the bomb is going to explode. It's not healthy. So very important to start thinking about that, right? It has to be a work that at least makes you interest, or that when you get home, you say, I feel proud of myself, what I did, right? And also to take care of your mental health, the first thing that you need to look and seek for is self-awareness. I need to know myself a little bit better so that I can know when I'm not doing better, so that I can offer myself what I need at that time. So we are running on automatic, go, 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 go. And we're not spending time thinking about who we are, what do we need, and how can I get what I need. And that affects our mental health and our physical health tremendously. So my hope is that we're gonna get to a point where we're gonna be able to shift our priority. Today in our modern world, the priority is productivity and profitability. We're not prioritizing human beings. Until we continue doing so, we're gonna have sick people, until the point where we're gonna have to go to the other extreme, where we're gonna have so many sick people that they're not gonna be able to work, and we're not gonna have productivity or profitability. So we're almost shifting there, but I hope that at some point we're gonna be able to value more human beings. We're all human beings, we are all here, we're in the same boat. So if we all value more human beings and treat ourselves as equals, I couldn't hope for anything else.
That's amazing. Thank you, Nadia. So just to cap things off, just to wrap things off, for those of you who are listening live or watching this recording, know that there are resources out there for you, that we are all at different points of our mental health journey. So try to not, place any judgment of where you're at, right? And just know that there are resources that could help you out. So for those of you who are looking for more tips, right, that you can integrate in your everyday, and or perhaps might be interested in booking a session, sign up for PsyMood, PsyMood.com. Also take a peek at their social media sites as well. They're on Instagram and on Twitter. On Instagram, I know that they do like weekly tips. So that'll show up in your feed once a week. And if you're not ready to book a session yet, take a look at the content out there. They should be helpful as well. For those of you who are managers or leaders within your organization and really want to understand how to bring some of these solutions into your team members, I will share an email address with BCCC that you can email and get in touch and let's discuss and talk it out. So yeah, unless Carolina or Mariana want to add anything, that's a wrap for me and us.
So sorry about the sun. It's just very bright right here right now. But first of all, I'd like to thank you all for this amazing, insightful discussion. Nadia, I wanted to start doing therapy with you. You're so calm. I love it. It's definitely a very, very important issue. And for us and for our members, we're here as the Chamber of Commerce as well to help the companies understand what is available for the employees, but as well as a training tool for the leaders. And I think that there's a lot to be done. And I agree with Nadia when she says there's a lot of productivity and profitability. We're putting the human health as a second plan. But the problem is this is starting to get so expensive that it's going to start making no sense. And I hope that we reached a point where people realize that the way to save money and to be successful is to invest in the people who is making the money for you, right? So because that's kind of the big, without the humans, how are things going to be run, right? So, and I think I agree. I hope that this is the start of a very, very big discussion on how PsyMood can be that connector and that facilitator to democratize therapy. Because in the end, it's all about having access and know how this can help. And like Rodrigo says in the beginning, I hope everybody starts enjoying therapy, because when you start doing it, you realize how good it is for your own self. So I'm also a big fan. So it's thank you so much. I really appreciate you being here. This video will be available on our website within the next couple days. And if you have any questions or if you wanted to learn more about PsyMood, please come and talk to us or go to PsyMood.com. And as Carolyn said, sign up for the platform. You won't regret it. So I do want to thank also our annual sponsors, Vale, Expert Development Canada, Brookfield, Lundin Mining, TSX Ventures, and Cisco Bahio for the support. We hope the information we shared here today was fruitful and relevant for yourself and for your business. And please keep engaging with us. Sign up for the newsletter and follow us on social media to stay informed of our activities and events at go to brasskanchamber.org or at brasskanchamber on our social media. I hope you all have a great day. Stay healthy, stay safe, and I see you all very, very soon. Hopefully in person next time. Thank you so much, Rod and Carolyn and Nadia, for being here today. Thank you so much.
Thank you, Carolina.
Thank you, everybody.
Thank you.